Dentists cannot teach the dentist how things work below the hyoid bone. At best, they say there's connection, but it doesn't tell you how. So my very early training during 2019 was just all dentists, all the best camps. And as I'm seeing 2 decades, 3 decades later, these patients that have had those treatments are still failing, I knew there's something missing. I've never seen a set of teeth walk by themselves into the operatory and sit in a chair. There's always a body that brings it in. And if that's the case, then that body is a really important part of that, the way that system functions. I see a lot of patients and I look at them from every angle. I look at their bodies, their actual cranium posture and their nervous system and their sleep. And then I look at their history and what they say as they're talking to me, Rachel. And they're like, well, I've been through all this other people and nothing has worked. And I'm like, yeah, you just declared it right there. Why don't you just practice, repeat after me? I can heal. My body can heal. My body can get aligned. And the reason why you're sick is because you're out of alignment, because you're breathing out of alignment. What I've started doing with Vivos appliance, I took it upon myself to say, listen, people, you have a mouth that's connected to your tailbone. If you can agree on this one, then everything else I say will make sense. If you cannot agree that your tiny change in the mouth can shift your tailbone, then we really can't convo about this. So what I wanted to create was a system that respects that complexity, but also coherently works with it as I make the changes properly in the second phase. My daughter is my origin story. During the time 2019 is when I knew that my answers were not sufficient. I wanted to come out of clinical dentistry. My daughter was at that time 6 years old. I looked at my daughter and I'm looking at the school that are just forcing me to put her on medications for ADHD. She's in first grade at that point. And I'm thinking, if I cannot help the most important person in my life, who else am I failing? I think that combination of everything, it was that perfect storm I needed to say enough, pushing back my own mainstream. And today I'm sitting here with a skull in my hand and everything in my head, telling my child has problem all the way growing, developing birth after birth, like almost everything was set up. The domino was set up. When I caught it, it was not the first domino effect. It was almost like towards the end, because by the time they're 7, their face is almost done growing. And that's when I started working on my daughter.
All right. Well, Dr. Bahar, welcome to the Unfiltered Healing Podcast.
Thank you so much, Dr. Rachel, for having me. We're excited about the next hour that we're going to talk and bring our fields and see some amazing sparks happening. It's going to be awesome.
Yes, we're so excited and we're honored to have you on the show. And I'm also really excited to chat and share with someone, as we were already chatting before we started recording, who understands really the importance of looking at the body in an integrated way. And it's pretty amazing that, you've been a pioneer and you've pioneered a clinic in addressing really that integration part with all of the collaboration of different professionals that you have, which is just so ideal. And I'm sure, you'll chat on that later about the flow of how all of that works. But first, with those who may not know, your coined term Airway Queen or all the videos you talk about the foot in the mouth connections, could you give a little intro for the listeners on who you are?
You were starting with the Airway Queen. I'm like, you've got me there. I don't know how to explain that. There's the comeback from that one.
Yeah. So who you are and, how you came to do what you're doing now, and educating and all of those things.
Wonderful. Well, Rachel, I'm honored to actually bring this perspective with you, because SOT chiropractor is a field that moved the needle for me as a dentist as I took my journey into becoming an airway expert, Airway Queen. The last 5 years has been nothing short of walking through barbed wires. My background as a dentist was just your normal average dentist. 10 years of practice from 2009 to 2019 was just having a drill in my hand and fixing downstream problems of body disorganization. By grace of God, I was interested in TMJ after I bought my practice in Boulder and seeing a lot of TMD disorders and a lot of Adderall prescriptions, younger adults that are on a cocktail of medications for mental disorders and TMJ problems. So I was really trying to focus my practice on TMJ, which was a fascinating joint to me. And back in 2019, what I couldn't recognize and realize is the connectivity of this joint to the rest of the body, not directly anyways, because I've been a personal trainer for as long as I've been a dentist. And I recognized early on that the patterns of the body, like the lumbar extensions, asymmetrical patterns in the pelvis, and a lot of movement patterns and feet presentations go along with a lot of malocclusions that I see. Have I not been blessed with having those professions early on together, I probably wouldn't be seeing that. It's an observer effect. As we know, there's a quantum involved. And when I recognize the connectivity of the two, even though I didn't know the intricate and nuances, but it was really a segue to get my curiosity up and going. And as I'm going to advance my career to specialize in TMD, because there's really no formalized residency or specialty in TMD, as you know, I
Mhm.
started thinking and learning that there's a connection between airway and TMD disorders. But I wasn't getting the answers I needed from the dental trainings because we are bound to the initials after our name. So if I'm a dentist, I get most of my C's from dentist. Dentists cannot teach the dentist how things work below the hyoid bone. At best, they say there's connection, but it doesn't tell you how. So my very early training during 2019 was just all dentists, all the best camps. And as I'm seeing 2 decades, 3 decades later, these patients that have had those treatments are still failing, I knew there's something missing. So the
Mhm.
best that have ever happened to my career, not to the world, was pandemic because it gave me that one stop move, the cycle of paying the bills and the hamster wheel during pandemic when I didn't have to go anywhere because the whole world came to a screeching halt at that point. I had the time to think, what do I want to be when I grow up? This has been 1 decade. I came, I saw this isn't giving me the answers. So 2020, I started to think about exiting out of dentistry and starting to open my horizons slowly but surely towards outside of dental trainings and really nourish what was really meant to teach me how the mouth works, which is why after 5 years here, I can sit down here, it's going on 6 years, telling you, Rachel, it takes at least 10 or 15 professionals
Mm.
to make the mouth work. And I say this with love in my heart.
Mm.
Dentists are not qualified to treat the disorders of the mouth. Maybe just directly impact of them on the teeth, maybe if it's biological, from microbiome standpoint, pH. When body's in the state of survival, almost everything goes downhill.
Mm.
And the next impact becomes destruction of soft tissue, pH changes, vestibular microbiome changes, which it's inevitable to damage the teeth. When the orthopostural stuff, ground force, and what is required to move us up against gravity is failing and are shifting from one side to another to do human on 2 feet is not working, the direct impact of it is on the teeth because we have 2 feet on the ground. And as bipedal, we have to support our head in the center of gravity. So knowing what I have learned at first, it was painful because you know what you didn't doesn't work. You're just basically a carpenter fixing downstream problems. You don't know where the leak is coming from. You're just basically trying to fix it at the surface. Yet at the same time, I know there's leaks that I need to close. And every patient that comes in is a potential to fail if I don't understand it. I have a whole set of training that didn't serve me. I have a whole lot of diagnosis that's preventing me from doing anything that I've learned because I know it's almost like you're going from a state of unconscious incompetence to bliss to state of conscious incompetent. It's not fun to where you go through the grind and the barbed wire, the sanctifications to actually become
Yes.
consciously, unconsciously competent, where your brain and your heart and your hands operate on the same frequency of knowing that I don't need to intervene in anything. All I have to do is have an observer effect of knowing where the incoherence really is and what do I need to do in my part to give this body, this soul, this whole system a chance to come roaring into that flexion extension, to be alive, the pulsation of breathing and respiration. So that's in a nutshell how my journey was. And I met so many amazing souls that not only were I was blessed to treat them because
Mhm.
we are working together. They were the teacher and I become the student now. And we learn how the body really operates as a whole. So as you and I know, the word holistic, I'm quoting another two dentists, mom and daughter, that the daughter, younger dentist, she said, we need to put the word W before holistic. It's a whole body holistic system. And that's why you and I, regardless of initials after our profession, we're like, we're looking at the same thing, aren't we? That's amazing people to see. And that's how I surround myself with the best chiropractors, physiotherapists, neurologists in my practice, because we're solving this human puzzle. I'm holding the puzzle together.
Yes.
together.
Yeah. And I love that because, in kind of the, I guess, alternative medicine functional sphere, you do even in that hear a lot of siloing. So, for instance, people hear of holistic without the H, dentists, and then they're kind of just focusing on more natural methods or removing, the toxic amalgam fillings. But then you have an airway dentist who may not have those holistic methods, but they have their own method to deal with airway, which may or may not actually collaborate with other people. And then you have the TMJ specialist who, again, may or may not collaborate with anyone when that is, like you've said, a whole body picture. And so what I love that you've and really what you went through is a crushing. Like the Lord leads us through different seasons of crushing and he's like, "Oh, that's nice, but this is what I have for you," you know? And that is hard. It's really hard to let go of what's familiar and what's safe and to step forward in faith and discover all of those things with him and let go of a lot of our own control and things of that nature. It's hard, but it's so worth it. It's so worth
I think
it.
this is something for your audience to hear. It's like, why? Because I keep constantly getting this question
Mhm.
on Instagram. Why aren't there more dentists like you? Why aren't there more doctors like you?
Yeah.
Let me say this. Doctors that are like you and me are not born, they're not coming out of training, mainstream training, having the knowledge of the whole body. Because in mainstream training, they teach us one thing. And I'm going to speak from my end because that's exactly what it was. Here's a disease, these are the signs of the disease, and here's how you maintain the disease.
Mhm.
And basically keep him in a new homeostasis. It was never about bringing him to the health and homeostasis of adaptive capacity for the body to naturally do that. Every adaptive capacity we are afforded by medicine is at the detriment of something else. We have blood pressure medications to control your blood pressure at the detriment of something else. We fix one problem by creating another. Every solution is creating another problem, basically, with pharma and surgery.
Mm.
And that training is what we all get when we come out of mainstream. And we are up to eyeballs in student debt and a decade of our life that we spend in mainstream training and lack of income, and we're in a third, fourth decade of life trying to build a family and a business. By the time we start to question that system, we can afford to question that system. We're in our late 40s and 50s. And at that point, you're so reticular wise set in your ways that you're like, well, at this point, what do I do? That is really the reason why those of us that leave the matrix would say, we awaken into understanding that that's not the right way.
Yeah.
And we'll listen intently to our patient instead of saying, what is the ICD code that's going to get me paid today? What is the dental code that gets me paid today? And say,
Mhm.
maybe I don't get paid today. Maybe all I need is just learning what it is that I'm here to do. What is my soul here to do other than paying the bills? And that question, it's not a cheap question to ask. And I'm going to say it takes a lot of courage, like you said. And in my case, it was more like I have an A-type personality, and I don't I don't take the answers on the surface. I question things, and feeding that curiosity was well worth more for me than building my asset profile. So I took a big loss to walk away from mainstream dentistry and marching with the rest of the team just to understand as a dentist. And that's not another problem is when you are a dentist and doing what the chiropractor is supposed to do
Mhm.
and looking at toes where you're supposed to look at their mouth, it's a no-no. Like you could get in trouble. It's like your licensure limits right here.
Yeah.
And I mean, I've never seen a set of teeth walk by themselves into the operatory and sit in the chair. There's always a body that brings it in. And if that's the case, then that body is a really important part of that, the way that system functions. But it's been a joy, and the pain was in the joy was in the journey
Mhm.
of becoming, unbecoming first, then becoming what you are, becoming next, which is what we're doing right now. And every time I meet a new chiropractor with a new perspective, it's like kid in a candy store for me. Let's see what you know. Let me tell you what real health is doing. And in that exchange, what happens is that the servanthood of love that we have for humanity, because we are gifted, specifically each one of us are gifted, for doing something for humanity, to bring them closer to the source and light. And if you're just sitting still and getting in with what our soul journey was,
Yeah.
we understand very quickly that those titles that we have coming out of school does not suffice, not even 1 second of it.
And where specifically in your journey, because I know that you're also a woman of faith. So, where in your journey did you actually encounter Jesus? Because I know a little bit of what you've said, coming from Iran, and that's a very Islamic background. Um,
Mhm.
and, when you encountered him and decided to follow him, at what point was that for you? And has that had a profound, also evidently, impact on your business as well and making those decisions?
I'm loving how you said when I found a person of Christ, because I was born in Islam. By default, when you're born in a Muslim country like I was, you're Muslim, and I had no access to any other religion, which I don't think Christianity is about religion, but any other than what you know.
Mhm.
So when I came to United States, I was 20 years old, and I was full blown practicing Muslim because that's what you do. That was my first getting to divine. And I had a very distinct encounter with Christ because I was going to church with my brother who, introduced me to Christianity. And at 24, I got baptized, but really I didn't have a relationship with Christ. I didn't know Christ
Sure.
and what his message of gospel was. 40 years old when like I said, the turn of events that happened to bring me out of out of the matrix of practicing mainstream was about the same time where when I had the time to sit down in my soul to see what do I want to be when I grow up, and I pick up the Bible and slowly but surely be coming back to the Word of God and sitting with my soul, letting the Spirit lead, intervene as we are told, and learning what the Word of God is telling me right about the same time that I took on my journey of coming out of the matrix of mainstream and learning to become who I am. So it's been almost like a side by side journey of learning what Christ's message was for me at the same time as I'm opening my spiritual gift. I don't think one could have happened without the other, because
Yeah.
when I was practicing the religion of Islam and then the religion of Christianity, which is nothing but just doing the mindless act of going to church or,
Yeah.
basically reciting things that did not have a soul effect on me, I don't think I really was following Christ. But it's really interesting, Rachel, to tell you, um, almost every person I've met along the journey the last 5 years either became the mirror to know what I needed to change, as I call this process of becoming, and not just our profession. I mean, look at Christ himself, right? The savior of us that came to save us all, to show us the way. He was a carpenter for the first 33 years of his life. David, the anointed king, he was playing harp, and he was a shepherd, and he was being sanctified when he got anointed.
Mhm.
And when he prepared to carry the message or whatever that he was anointed for, there was that gap of sanctification. And I believe the length of that has a lot to do with what we choose, how short or long that becomes. That 40 years in one desert
Yes.
from the promise that is what we decided to be. And all those people that I've met and encountered in the last 5 years, either they showed me what I needed to change, like the silver getting purified in the fire, or they were an instrument to direct me to the right direction. And none of it was a coincidence, not single one. And I felt like your spiritual gift is prepared for you. No one can carry it but you, including you, especially you when you're not prepared for it. Like, you have to exercise the muscles of knowing what you're carrying is truly a gift, and that gift is for other people. Like a tree that brings fruit. The fruit is not for the tree, but the more fruit that the tree has, the stronger the roots of that tree become. And that's really that whole process of growth. The mustard seed of faith Christ was referencing is just that. When you have faith that I'm on the right trajectory, your nervous system knows it. It's like you have a calm about you. He calls it the peace that surpasses all human understanding. I really understand what that is, because everything that I learn every day, it comes to me rather than me chasing it. It's like,
Yes.
"Man, what do I need to know to share my gift with whomever that I need to share, and let those events unfold in my life." And we don't resort to that power of prayer, which is our mouth. Surprisingly, that happens to be my ex. the tongue, the tongue.
Yes.
I have several things that really just scientifically prove to me how Bible is written in a quantum language, because Jesus spoke a lot of metaphoric language, which is very distinct for pointing to something bigger in a language that you can palpate and understand. And that's really been the two aspects for me has been merging together. My spirituality and my scientific, the left and right side of my brain has really merged together, to know we were never separate. We were just living an illusion. And when we come out of that, we are able to see the we realized what we are doing on a day-to-day basis was our calling all to begin with. And we're just coming to experience it as we are in the flow of giving it to other people. That's love. That servanthood is love, basically.
Yeah. And, the scriptures tell us multiple times, but specifically in the New Testament, that, those gifts are formed by reason of use. So you also have to utilize those gifts with the Lord and surrender them to the Lord and have Him equip you in that way. And that's a process. And we all have a wilderness. We all have a process that we go through. There's no comparison. But I love that. I love sharing that as part of your journey. And I had a feeling that was the connection in the change. But I wanted to clarify that, that was kind of the tipping point, so to speak, was you had an encounter with the Lord. You went to the Word, which everything we need is in the Word of God. And then you begin to have a new revelation of, okay, what does the body really mean through the lens of Christ? And that's a beautiful thing. And that's, what we all, as people of faith, aspire to be, is to use every gift that we have to the glory of God in whatever sphere that it is, in medicine and finance, and, wherever your business is to utilize it in a way that glorifies the Lord. So I love that, the evolution of that for you. And it's a beautiful thing. So thank you for sharing that.
Yes, and you know what I'm loving is where there's more body of Christ that are willing to share this connection and speak about what Christ has done in my life. How is it me aligned with Christ? And that's my every patient that I see. The mission statement I wrote for our interdisciplinary care is specifically saying, we know that your nervous system is what I know, I believe, is the nervous system, is that what kingdom is within. And regulating the nervous system, it basically reflects in how you breathe. Because my focus is getting people to breathe better, which basically enables them to breathe better in all directions, including when they're asleep. And in the book of Proverbs, God's saying, I will grant sleep to those that I love. And our sleep is that sacred space where we go to disconnect with the body, which is our third density existence, our soul within the matrix of our body, to experience the things that we experience. And in sleep is that separation of the two. I think that's where we actually go into our, not just delta wave, but our spirit goes back to its origin. And how much of those brain waves occupying our frontal cortex, what we're consuming every day, what we're engaging with every day, and what we're surrounding ourselves with every day becomes our reality that basically determines if our soul is bound to our higher beta wave theta in that survival state. So we never are fully awake and never fully asleep. And our human experience is basically haphazard versus when we are in that full surrender mode, our breath reflects it, and our soul is separate from our body to experience what it came here to do while it's carnated in this in physical state. And actually, one thing I want to reflect is the whole breath itself, because we know that in Genesis 2:7, God created man from dust of the ground and blew the breath of life into the man's nostril, and Adam becomes a human soul now. That was the first that he had. So God created us in his image, and the Ruach came to our nostril, and we become a living thing. I mean, let's go back to the state, because that's where we both understand, taking it back to the origin. Forget about what we do outside in our professions. Just take it all the way back to the beginning. We were coming from one cell, one human cell that formed us as who we are right now. And how did that become? That separation from the source. We become the human, and a human that has a spirit that is from God in a flesh. Well, that cell become two, the two become four, and eventually a bunch of clump of cells that at that point does not have a heartbeat. It's just a clump of cells, and each one have their own universe, nucleus, cell wall. And the notochord was formed to bring about what becomes the basis of our nervous system, the notochord. On one end is the perineum, the sacrum, and on the other end of it is, if you take it all the way to the pineal gland and the nostril, when the streak of light comes into that notochord, then the flash of light comes into that embryo, which has been documented in artificial inseminations, which basically they have embryos, and the one that flashed the light, they know that's the one that's going to survive in when they're implanted. And as the light travels through the spinal cord and it goes all the way from the perineum all the way to the pineal gland, that traveling of the light through the astrocytes activation, that's the primary respiratory mechanism. Then now that clump of cell is the embodiment of the spirit that came into it. And then there's a heartbeat that kind of matches that. And from there, you and I know that all the cells migrate in the peripheral nervous system, central nervous system, and that's all shenanigan that comes afterwards. But the first initial and that astrocytic activity, and that's what they have been documenting, is even active after the heart stops, even after the brain stops. We know those astrocytic activities is still going on until the soul, the ruach, leaves that body, completely leaves that body. And now that body goes back to the dust. And that beautiful, beautiful sentiment of knowing that without the light and the spirit of God in us, we were just a clump of cells, dust. And after that ruach leaves, what happens after we come from that womb to the next womb, which is this universe, to the world? And that is the creation God created for us, is we now acquire breath, which is the diaphragmatic breathing. And that's nafas. That's basically connected to our diaphragm and barometric pressure. And that breathing needs to match the ruach that was in the first place there. And then the person that's our personality, and that becomes a source of our speaking ability to speak as we start to basically gravitationally start to take our breathing just from our chest and upper abdomen, upper part of our diaphragm to just now below diaphragm with gravity. Now we can speak. We stand up and speak, which is a human trait. And every word that we speak creates the reality we live in. So the language, the culture, what we are saying with our mouth, and what we allow our eyes and our ears to implant in our frontal cortex, which become a reflection of what we say with our mouth. And I believe it's one of the letters that Paul wrote, was just talking about meditating on the word of God. So everything that you're saying, focus on all of these positive vibrations. I'm not being new age about it, but really though, we are the frequency of God in the flesh. Speak of those things and just watch your reality change.
Yeah.
And I take that very seriously because I see a lot of patients and I look at them from every angle. I look at their bodies, their actual cranium posture and their nervous system and their sleep. And then I look at their history and what they say as they're talking to me, Rachel. And they're like, well, I've been through all this other people and nothing has worked. And I'm like, yeah, you just declared it right there.
Yeah.
Why don't you just practice, repeat after me? I can heal. My body can heal. My body can get aligned. And the reason why you're sick is because you're out of alignment, because you're breathing out of alignment. Why don't you believe in that and let that be your source? I mean, to know that we are created so wonderfully and fearfully created.
Yes.
It takes a lot of faith to know I am not this body. I am not this dysfunction. And so long as I'm in line with the breath of God, my body can find a way to be organized and operate out of that pain and dysfunction and just about every label that medicine puts out there. Right?
Yeah, that's so good. And it's always such great reminders that, we are a spirit with a soul in a body. And that, like those scriptures that you're saying, life and death is in the power of the tongue. So obviously, like, a big proponent of the mouth is a huge thing. And so it is really important to align your soul with your spirit and to heal your body from those things. And so those are all of what we've recognized and we've had revelation on through the Lord, and how we've navigated how to then heal this temple and get it back into alignment with its identity in Christ and how it was formed and how it was created. So I love that. And I know that a lot of, what we're talking about is things are as a result of a dysregulation in the nervous system and in that system. So that can even start, back, like you're saying, in really early on. And most of the time, it does happen really early on. So, can you shed some light from your perspective of how you integrate that as well?
Rachel, I've been treating patients from 5, 6 years old because until they have teeth, usually they say the dentist will see them. But I was fortunate enough to have encounters with a lot of younger patients that come with their parents as well. So it opened up the horizon for me to work with a lot of craniosacral therapists, reflex specialists, especially MNRI is my favorite. Dr. Maskatova, the brilliant practitioner. I know her personally. looking at the primitive reflexes and how our nervous system was dialed from birth onward to go from brainstem to midbrain to higher cortex. A lot of functions that I see as a dentist, as a functioning dentist, where at the tail end of it is basically the trigeminal nerve, which is, it's sensory, it's motor, it's got autonomic, integrations with its sweat, the tongue function itself. There's 3 branches to trigeminal nerve, which is basically the most important nerve I work with. Our facial development, especially the lower part of our face, which is growing with us as we grow. Between 4 to 7 years of age is when the facial growth and development and the proper orientation happens. A lot of important functionalities happen in that early stage of development, which means neurology first was there. We were fully sensory before we were motor. The child is born cannot even move their neck. They cannot, and they, other than survival, suckling and swallowing and sleeping, there's not much that baby does. In that during period of first year of development, the most important organ that controls that child's, nervous system is their tongue, because it's a survival part of them for suckling and swallowing and being able to digest. If there's structural limitations to the function of tongue or distortion in the cranium, which you and I know, controlling the nerves that controls the tongue movement is in between the lobes of the occiput that need to go through the birth canal. So if there's any interruption in the birth process and activation of the primary reflexes that help the child go through the birth canal, or perhaps pre-birth, a lot of reflexes like Moro reflex, fear paralysis that are activated before birth, in preparation for birth, from the amniotic fluid, from mom's state of mind and health, activations that are also dialed with the cortisol in the amniotic fluid. All of that impacts how the child is developed in the womb. My favorite example I'd like to give, Rachel, is, I'm not sure if this is going to be an audio or not, but I'm just holding a paper right here. This paper is the human gene, is one human cell with all the every genetic response that can generate depending on what environment signals to the cell wall as it starts to develop, become 2, become 4, and it becomes a whole human being. So every stressor, whether mechanical, neurological, psychological, or any vibration in a form of vibration that comes to this cell to develop, consider that like as if I'm putting forces to fold this paper. I'm forming it into supposed to become an origami. The signal that comes through that cell is supposed to be proper, in a proper order. The environment in the amniotic fluid, the nutrition mom is exposed to, toxicity she's exposed to, the health of the mom, how she breathes, everything is going to impact the development of this. So it becomes an origami when it comes out, right? We think that children come out of the womb perfect. Not really. Especially the modern living. I mean, I actually love to give back everything to the scripture. That we know, I think it's Psalm 139, that we were knitted in our mother's womb.
Yes.
So guess where the power of darkness is starting to impact children? Through the mom's umbilical cord and amniotic fluid, through the food, the stressor mom is getting, like, just the moms are not able to be moms and develop the babies like we were. I was working full time in a very toxic environment when I was pregnant with my daughter, all the way to delivery. So imagine everything that I was exposed to, she was exposed to. So what does she come out of? Not like a full-blown, perfectly shaped origami. You get this at birth. We're thinking it's perfect. It's supposed to nurse. It's supposed to roll over. It's supposed to everything. This child is already in survival before they're actually going through the birth process. Don't even get me started with all this scheduled cesareans, unnatural environment on a hospital beds for delivery. Just about nothing is natural for that child to make it through the birth canal. And when they come out, the first breath is survival. Game on. Let's static. Like that nervous system is stuck. I mean, they were formed with dorsal vagal. Now we're in full dorsal vagal, and that nervous system is constantly responding to the stressors even more in an incoherent way. So instead of primitive reflexes helping that child to now get sensory information and become motor, they become dysfunctional. So distortions in the cranial patterns, which you're familiar with as a pediatric SOT, the tongue posturing. So they're basically trying to emulate what would have been a proper posture of their palate to their cranium. That's why they thumb suck, colicky babies, lack of breastfeeding. They are not born. It's not lack of breastfeeding. It's the fact that that tongue never separated from the floor of the mouth properly. And in the womb, the tongue posture was improper. Fun fact, first bone in the entire cranial structure that forms is the palate. And the first muscle after heart is tongue. So from the minute that the child is forming, the tongue pressure on the palate is forming. They're not going to acquire a high arch palate later because they didn't breastfeed. They never formed to support that function.
Mm-hmm.
And biology stuck in the brainstem, so they continue operating with survival reflexes, and their breathing, their suckling, their sleep, everything is impacted. So that child now is up against gravity, leaving mom's cradle to now go roll over, crawl. They cannot deal with gravity and the stressors of environment as to push and grow. So they stand up uneven in an unnatural way, and gravity is pulling him down, and they don't have the right mechanism to activate the whole breathing from diaphragm, from the pelvis to the upper chamber, to the throat, to cranium, to breathe against it. So what do we get? A distorted face, cranium. And what does that result by the time they're 12? A maloccluded mouth, because the facial growth, which is trigeminal nerve, second and third branch of trigeminal nerve, formed through the function, poor neurology, poor form. So we have distorted mouth, we have distorted occlusion. What does that mean? Nervous system was already in survival that is responsible for forming that face.
Yeah.
So if the teeth were in a perfect occlusion, in a perfect orientation to the face, that would mean the nervous system is perfectly in harmony. Well, it's not. That's why we don't have perfect occlusion. And creating the straight teeth illusion without addressing the body that's already in survival is putting straight teeth on a crooked body that's failing. And to a great degree, if they have no way of coming out of that compensation, when I see them, Rachel, when they're 25 years old, they have anxiety through the roof. They cannot think like a human. Their digestive is impacted. They cannot sleep. And unfortunately, diagnostic metrics for all those labels that would give them some level of health, help, not health. It's not going to register until they're late in their 40s, like 30s and 40s, like Hashimoto and thyroid, gland function. And if they're fortunate enough to see someone like you might actually direct them and say, well, this is not just about your mouth. It's all about the body that formed the mouth. But that disconnect you mentioned, well, I'm just a TMJ doctor. I'm really not focused on this. Explain to me how the mouth separates outside of the rest of the body before you say that I'm only specialized in one area. I'm only going to work on this part of the boat and poke a hole in my area. I'm really not going to impact the rest of the boat. It's a vessel. Anything that fails, the whole body has to absorb that shock, and something has to fail for lack of function in one or the other. So,
yes, brilliant.
Well,
that was really brilliant. And a lot of times, because there is the lack of education, which we're trying to push out there, because we're only one person, right? And hopefully this will inspire more to step out and be like, hey, I actually really want to help people and not just be siloed in here. Is unfortunately, when they get to that step, when they are at those ages, then they are going to, the dentist, or they're fixing, the teeth, or they're getting a tongue tie release without having taken into account all that you're saying and so eloquently laid out, is that there is a body. Like I tell people, every orthodontic case is a cranial nervous system case, because that's what started it first. And so we have to kind of look back and, we're not trying to put fear or anything. We're trying to explain how these things come to be. And if we can unwind them and actually change the paradigm of how we treat and help people, then they actually do get helped, and they're not so desperate, and they're able to adapt to our ever-changing environments that are very toxic and very polluted, and so much fear and so much anxiety. And when you've built a very healthy, adaptive nervous system, you're able to handle those things way more effectively, which we can both attest to, having our own journeys in that. And a lot of times, I actually just posted about this, but a lot of times as well, like you said, the straight teeth doesn't necessarily mean a healthy body or a healthy mouth.
It never does. As a matter of fact,
Yeah.
When I treat patients that had orthodontic treatment with my, unfortunately, retraction orthodontics, which is extracting not just wisdom teeth, but
Yeah.
four extra premolars to
Mhm.
fit the teeth to an underdeveloped face, which a lot of things contribute to the underdevelopment of arches. I hope that
Mhm.
a little bit about that today. But when you see a mouth that does not accommodate the 32 teeth that it was supposed to, whether it being from a mastication, articulation, speech, postural orientation, gait cycles, indoor living, like you said, anything that disrupt the proper sensory motor function that conforms you was disrupted, wasn't there. That just says there's this, it's a signal to say I didn't fully develop. But we're so infatuated by straight teeth that at whatever cost, we want to jam those teeth into this arch
Yeah.
that looks pretty because that's our signal, social signal to the world that I got it together.
Mm.
But let's just let that settle. That system we just created is changing the arrows on the highway, telling you that city is over here. By changing the arrows on the highway, we didn't change the reality of where the cities are. We just changed the arrows. We are still in that state of dysfunction. We just cover it up with this facade that we have to now, it's the avatar, I call it. The face is the avatar of the nervous system.
Mhm.
And the face is distorted. It's a speaking volume of nervous system that's dysregulated, which is not in harmony, trigeminal nerve being one of the largest nerves, and control of a parasympathetic, sympathetic. Why do you think we clench our teeth? There's so many reflexes geared to the teeth that when we clench, it forces our nervous system momentarily into the parasympathetic. There's actually a cardiac reflex. It's called trigeminal cardiac reflex that is geared to the sensation of the mouth. You ever passed through a red light and you thought you were going to pass and it didn't? You go clench your mouth. Why do you think we clench when we're in a state of stress? It
Mhm.
gives that sense of, okay, you're safe,
Mhm.
right?
Mhm.
And how does that safety go in? Like, if you think about how safety is established, and I love chiropractors because this language is so intuitive. And I was thinking about that the other day. Why is it that most of the spiritual practitioners I've met are not dentists, are not podiatrists, are not the gastroenterologist, they're chiropractors? Because if you think about our spine as the kingdom that I was talking about, from the sacrum all the way to the occiput, in between is 33 vertebrae, right? And 33, I mean, I want to get a little bit spiritual about this, not a little, but truly spiritual about this 33 years of Christ on earth. And the CSF being the oil of anointing, practically, it's that
Mhm.
is that fluid produced in this in our coronal plexus that basically nourishes our brain and our nervous system, which is the essence of who we are. And what really regulates that is that connection between the tailbone and the head to support us being bipedal. We are not, we are not families and relatives of gorillas. We are created in God's image to be bipedal humans, stand on 2 feet with our head in the center of our gravity to support our airway, the nafash, to be in alignment with our ruach, which is the primary respiratory mechanism that's controlled by the foramen magnum through our tailbone. So, in fact, every breath is going to get us into the upright. As a matter of fact, again, it's in the Bible that says God, Ecclesiastes, book of Ecclesiastes, God created us to be upright, which means our center of gravity, our vestibular system, our eyes, mouth, airway, nafas, be on the center of our gravity so we're not deviating from that.
Mhm.
Every large compromised airway I look at is somehow outside the center of gravity and is failing. And this patient's nervous system is in the state of shambles
Mhm.
because to create something outside of alignment, it takes a lot. It takes so much more out of our nervous system to
Yeah.
justify that. And then that puts us into that state of ego, dysfunction, and dysregulation, which is what you and I see down the stream. I can't sleep, I have anxiety, can't digest food. And I wonder why. Because you're out of alignment. But what tips us out of alignment is every, like you said, toxic environment that's basically robbing us the joy of being stimulated properly, how our nervous system was supposed to be, to learn every step of the way how we get our left side, which is our I mean, not the left one, but the non-dominant side with our dominant side, which is the
Yeah.
righteous right hand of God. Like, how do we get the left and right together in alignment? That's where I think that the whole system is failing, is to get our breath in the center of our alignment, and we're stuck. And in a stuck zone, I mean, almost nothing good happens. In a nervous system that's regulating and sympathetic constantly, not momentarily, constantly, nothing good happens.
Yeah.
You lose your adaptivity, basically, like you beautifully said.
Yeah. Yeah. And obviously, everyone is different, as we know. But what are some, like, maybe that you incorporate in your clinic, or things that you incorporate through programs with people? What are
Yeah.
what are some of the best, like, because we talk a lot about breath, right? And we talk about regulating the nervous system. Well, on a more like tangible side as well, what are some of the best like breathing or posture methods that you've seen have some of the biggest impacts on someone's, overall getting to that upright, getting to regulate the nervous system? What are some of those biggest things that you've learned and discovered?
Well, it was a journey of learning how to go back to the drawing board every time I learned some new information. So I'm going to give you the latest version, which is what I'm doing currently in my practice in Colorado. I work with a SOT chiropractor, specialist in not just adults but pediatrics as well. I work with neuroreflex integrations. I have worked with the neurochiro, specialized in vestibular and ocular alignment with a different part nucleus in the cerebellum. I work with biomechanic experts in breathing, PT type stuff, but with more like coherent with the body's ribcage alignment with pelvis and cranial alignment. We also have nutritional consultant. We work with functional medicine to address that aspect of the nervous system as well. So we created phases of treatment so that every patient in a safe manner, they get to not just them learning about their nervous system, but us knowing where to go and intervene for that nervous system compensation to redial them back into the state of how they were designed to be. Almost like, where did the storm set up shop? Was it the poor sensory information or lack of sensory information that led to poor motor function that gets you stuck in a dysautonomia? Or was it that you were lacking biosensory information? Maybe the hormone was in your genetic, your food. What dialed you into that state of sympathetic nervous system or amygdala, trauma, mental? Which one of these are the drivers? Because at the end of it, HPA axis lit up when there's sympathetic nervous system activity. So phase one is all about what part of your nervous system dysregulation is really dialed to orthopedics versus mental health versus biophysical health. And because to a greater degree, they all intermingle. So if you can't digest food and you cannot sleep and you cannot stand up and breathe right, you're going to be mentally also off. But is that a byproduct or is that the driver? That's what really comes about. What we actually love we're doing is with the admission that both of us being expert in the orthopedics of things, orthopedic, I mean as an orthopedic surgeon, but more like biomechanical aspect of. We look at the alignment of the body as one of the major drivers because nerve conduits and fascia is basically in between those bones and structure of vertebrae and alignments. So if there's a subluxation, is the driver of neurology being off and down the stream physiology, like digestion, respiration, sleep cycle, or was it the other way around? So we give the body a chance to declare and make it known to us. I don't go into it with any assumption because I'm yet to meet two people with the same dysfunction that got there the same way. So we give a chance to declare. In honest to goodness, is like, here's a chance to realign. And in my humble experience, if dentists only knew your role in that is the most important of all, you would not do dentistry the way that we are taught.
Yeah.
Mouth is the most important part of the chain of our gravity. Because when we as bipedal species, put our feet on the ground, the only other part of our kinetic chain, electric, muscular, primary, everything is the other end is mouth. It's inevitable. Even in the formation, when we were in the womb, it was first the perineum formed and then the mouth, the other two end. So when we put our feet on the ground to exercise our full human rights, mouth is the other end. Our teeth come into full occlusion, and when they get in, they basically lock you into the distortion you have had all along. Where you put your head with your mouth is going to basically distort all the other dysfunctions within the spine and spine, all of our functions. So the first thing we do is I come in with the metrics that I use, give a body a chance to come out of that dysfunctional occlusion by supporting the occlusion to where the body and physiology would work function best.
Okay.
A very simple appliance can immediately erase that set of information from the teeth. So cerebellum can now focus, how are the eyes and ears working? How's the cervical spine working? Can I really realign my pelvis, or am I forced to do that because the mouth was uneven? And within the first 6 to 8 weeks, we increase progression of the exercises, whether they're cerebellum or breathing, to see truly is it a functional thing? Because if we get the body a chance to breathe itself into alignment, there was never a subluxation with atlas or pelvis. It was all along the way they were forced to breathe. Wonderful. And if it doesn't, if there's a subluxation, then it needs a precise adjustment. Sometimes you need an upper cervical. Sometimes you need a great SOT chiropractor who knows how to deal with the pelvis and the cranium.
Mm-hmm.
And once you move those, the dural torques are addressed. Either they're unwinded out of it, like a phone cord. When you unjack one end, does this really unwind, or is there another kink? Then we come in with phase 2, our therapy, and I address the descending factors, which is what's in the cranium that was the driver from top down, in a precise manner, because I call mouth, basically palate, the roof of this entire system under which we exist. The palate is our roof. Where our palate is where our head is going to go.
Mm-hmm.
And our head basically is the other coin of it, side of the coin.
Mm-hmm.
Therapy, Rachel, is where I shine, because where I come in with our appliance therapies, Vivos have patents on this, but this new techniques that I'm doing as a whole method of vitality is basically a next generation of these appliances I'm patenting. And patients that come to our clinic, they get those appliances. We basically change the dura and the structure of the mouth in relationship to the pelvis, not as a separate entity. Like you said, your mouth is bone and toes are connected. So every direction, this removable appliances, we're torquing and changing the structures, the activation of the keys. The dura gets a movement. Then we see if that change is perceived properly through your entire system or not. Mm-hmm. And I've seen miracles happen in phase 2. I am not making this up.
Yeah.
I've treated hundreds of patients, obviously, at this point, and every single one of them, responses to the nervous system is so individual to them, yet the governing factor is the same. Give me a chance to breathe into this fascia. Give me a chance to reclaim the spaces I don't have right now and experience being a full human experience. Mm-hmm. And just watching personalities change. Rachel, I cannot even tell you. People come to me in survival and I say, can you tell me what life looks like when you're done with us in a year and a half? Not done with me, but like your body gets a chance to move direction, homeostasis with better adaptive capacity. How would life look like? In full survival, which, by the way, their metrics and all the other tests shows that their sleep tests, their pseudomotor tests, heart rate variability, everything says I'm in survival. Their answer is universally the same. I want to be better, but I cannot think of what that looks like because I have never thought of it. Sure. I can't even think what tomorrow looks like. And a year later, they tell me I'm changing careers. I want to help other humans. I want to share my gift. I found what my gift was.
Yeah.
And most of the people that are working in my clinic right now, including some of the professionals, they have been treated by me. At some point, they were a patient and now they're the professionals and they're helping other humans. Mm-hmm. What I love is when we all come together, and that's where I get to just say, the body of Christ comes together.
Yes.
We all have a spiritual gift. I don't have your gift. I work with some of the best professionals. Right. And I love seeing them unwind the bodies. And as I just make my tweaks on the top and make the part of the domino, I see bodies unwind. It's like, how would I do this without you right here under the same roof? How would I do this?
Yeah.
There's no way.
Yeah.
And when patients ask me, is there anyone like you? It's like, well, you can get an appliance. Okay, you can have a tool. You can buy it on Amazon. You could. You can't really, but
yeah.
You cannot create a Picasso art if you don't have the artist. You cannot, if it doesn't come from heart and soul, it's just a tool. You know what I'm saying?
Mm-hmm.
You know, it's the difference is where's our heart and soul and mind as practitioners? That's the difference. Rachel, when I was practicing dentist, I had a drill in my hand and I was fixing things. I wasn't really healing anyone. Yeah. I go from just a practitioner looking at the tissue on the body to looking at this is a whole human being, a soul, mind, and a body trapped in a body that doesn't work. Mm. And so that differentiation has basically turned me into what I am. And I'm still within the confinement of dentistry. I'm still a practicing dentist. Don't get me wrong.
Yes.
Perspective has changed so much that I see God through every soul that I be a part of their journey. I see God, and that transaction is just so beautiful. I can't stop smiling, as you can tell. Like sometimes I could have like not so uplifting day. You know how it is.
Yeah.
And all is just sit down in my soul, knowing that you're Bahar. You're exactly where you're supposed to be. Doing exactly what God put you here to do. And Spirit is guiding you. So if nothing else, just ask, what is it today that I need to do, and why am I sit with your Spirit, and have no doubt when you sit still, you will know and you become one with your purpose in God. And that's such a beautiful thing to know.
Yes.
Time is irrelevant.
Mm-hmm.
Everything will become almost irrelevant.
Yeah.
And you're Yes.
Yes. Well, I mean, I can tell that you've had a lot of education from us as people because a lot of your language is what we learn, which is
Yes.
beautiful. And we're taught as well to work with dentists because, like you said, it is the body of Christ. We all have the same goal, and that is to help the person in front of us. Now, one of the things that you mentioned in the last dialogue that you were saying is your incorporation in kind of the second, or maybe you said third phase of care, where then you're now incorporating this specific appliance called the Vivos, which is very different from like an orthodontic appliance and maneuver in that. Could you kind of briefly explain the difference? And then could you also explain what led you specifically to wanting to learn about this appliance, and now I think you're the president of it, which is great. Because there's also other things as well. I mean, there's several other ones that are like the Alpha appliance and the Homeo Block and the Schwartz appliance, and there's quite a few now. So can you also kind of explain how you navigated to that specific one and had so much success in
Yeah.
incorporating that?
Actually, if I want to say it in the most concise way possible, majority of the treatments in dentistry, and that was including my early on education, most of them are focused on how can we manipulate and move the teeth in order to
Mhm,
achieve better alignment in the temporomandible joint. It is almost universally accepted by dentists that yes, teeth are important, but the teeth are the most important actually. And if you can just change the trajectory of the teeth, the system would realign automatically.
mhm,
That's the mantra I never bought into. And what brought me to Vivos 5 years ago? Vivos appliances are removable. And our original design, the DNA, most people know about, it is known and accepted. FDA cleared us as an expansion tool. An expansion meaning that it actually allows all different parts of the arch to separate from each other to create the tongue space. And that is truly a beautiful thing that needs to happen because when body didn't form, remember I said in the womb, palate forms.
mhm,
So if you miss a chance in the womb and then the tongue did not really do its function after birth for whatever reason,
mhm,
I'm not going to lack of breastfeeding and just softwood because it's not. Umbrellas don't cause rain. It is a common denominator of lack of proper tongue posture
mhm,
for any reason. The palate doesn't form. So when you have a palate that's either small, uneven, or in the wrong position, wrong zip code in relation to the cranium, you're going to have problem with swallowing, breathing, and functions.
mhm,
So appliances will stimulate and change the trajectory of the mouth by increasing the space to give body a chance to properly posture the tongue. Vivos does use myofunctional therapy and a lot of other adjunctive therapies like laser to treat the soft tissue alongside so we can attain that. And that works for majority. But one thing that was lacking for me particularly when I worked with Vivos at the time as running one of their clinics was that it's the appliance part is important, but that's not the only piece.
mhm,
And what I understood as a uneven system, body uneven system, you cannot introduce anything symmetrical and expect it to work. You only get the really good results when the asymmetry that you started with has forgiveness, has a pattern.
mhm,
As we say, torsion versus a side bend. If things are completely contorted on one side traumatically, if you're introducing a symmetrical system that will stimulate it into change, there is no room to adaptability to accept that something else will give. And usually what happens is the fascia in a helical way, it will unwind all the way down to the tailbone and feet, and something else will give in response to gravity. So yes, you might expand the mouth, but you might restrict the tailbone. But how would a dentist know without knowing the two structures, right? So all of those other modalities you mentioned, I know actually all of their co-founders, some of them in person, like late Dr. Balfour, founder of HomeoBlock, great mentor of mine. I have learned something from all of them.
mhm,
Dr. Derek, creator of Health, great friend of mine, and he's a believer in the cranial structure. And all of them has evolved over the years, and the knowledge has been limited. And what I'm being handed off is a flower from any one of these amazing practitioners. And this bouquet that I'm presenting to you, and then some, and the baton needs to be passed on because dentistry hasn't looked into the structure of the cranium so much more beyond the mouth, other than those few names you mentioned. So what I've started doing with Vivo's appliance, I took it upon myself to say, listen, people, you have a mouth that's connected to your tailbone. if you can agree on this one, then everything else I say will make sense. If you cannot agree that your tiny change in the mouth can shift your tailbone, then we really can't convo about this. So what I wanted to create was a system that respect that complexity, but also coherently works with it as I make the changes properly in the second phase. So every phase of the appliance I use is mindful of how the body functions. First is about mandible, correlation to the neck, then about maxilla in correlation to the mouth. And when I insert the second layer appliances, which is what we call it vitality now, it's in the process of patent. Vitality is not just the DNA, it has several features that takes into account alignment of the cranium, hamular notch and sphenoid, and it will continue to incorporate functionality of the eye movement, cerebellum activation, respiratory changes, vestibular changes in relation to every mindful change that I create in the palate. So the appliances are basically designed for every patient according to what they need. There are blocks, there's activation screws, there are springs in different parts. So as the patient wears and swallows with these appliances, they will learn to create spaces where before they didn't have spaces in within fascia. And that changes really truly happens. What really happens is when we take the appliance out of the mouth and the brain is like, I want to recreate that experience with the tongue now. The tongue knows what to do because tongue is free to do that. And the tongue will continue to develop the arch in that direction. Usually patients are spending somewhere between 6 months to a year, which by incorporating a lot more cranial manipulations with SOT chiropractors, with a lot of neurological integrations, that's even becoming shorter because body doesn't want to be pushed. It wants to accept the change. And when we're going back to nervous system, the appliances, the keys get activated usually once or twice a month. We turn the activation screws, and once the patient wears it, the body stimulates the growth. They take it out of their mouth during the day, they continue going about their life and put it on at night. And I have seen, and that's what I actually look for, eyeball level change, ear level change, shape of the face dimensions change, mandible forward posture attaining, and maintaining, not just pushing the jaw forward, but maintaining that space. All of that over about 6 months to a year. The final phase of our approach, which I don't think there's ever a last phase, but in our actual alignment phase, we then see how much the teeth actually, because a lot of, like I said, earlier things that I learned was focus on the teeth, whether it be an expansion, whether it be an orthodontics, it's move the teeth. What I've done, Rachel, when I move and align the bones, teeth are like children in a family. When your family moves, the children move with them, like people sitting in a sofa or a city bus. Teeth not want to be in a dysfunctional space. And aligning and creating spaces between the two arches and in the cervical spine and in the tailbone and in the entire spine, the body will breathe itself against gravity in an upward direction, and the teeth literally drop into place. All this 6 years, just to give you a perspective. And in the beginning, I didn't have access to practitioner yourself. It would take up to 2 years, sometimes 3 years to achieve what I do. Now it's less than a year. Sometimes in 6 months, I achieve majority of what I need. And almost none of my patients, unless they really wanted their teeth to be that Picasso perfect, needed orthodontics afterwards. Thinking, if I don't need orthodontics to align the teeth, did we really need orthodontics? That's the question. Because what happens is when we put wires and plastics on teeth to push them, teeth are directing the primary respiratory mechanism out of sync. Gears are coming out of sync. What I'm doing is realigning the gears in the cranium, and the teeth follow that. They signal, here's a good place to be, and the neck posture changes, the breathing movement will realign. The focus that I have with Vitality, which I love the name, utilizing the breathing mechanics, the real alignment to reorganize the mouth, and somehow teeth happen to be a part of that. So I need. As a matter of fact, fun fact for you, I've never had formal training in orthodontics. I've never actually engaged with Invisalign. I've never done it. And so I've been doing this for 6 years successfully. I've had some of the best cases, chronic diseases, treatment. I 5 flavors of chiropractor, but I don't utilize orthodontics. Is there anything wrong with those? No. But I to do things in a holistic way. We're not considering the body. We're just treating the teeth. I hope that it was concise enough to, there's some oral appliances involved. That I can tell. But it's not a one-size cookie-cutter approach for every patient. And we let the diagnostics for that patient tell us what they need next. If you need to halt treatment, go back to the chiropractor, let's realign the pelvis before we turn the keys any further. So that's a lot of what I do. I don't actually keys changes in the mouth unless I know the body can absorb that. Otherwise, as we are putting forces within the cranium, it's going to go directly either in locking up the neck or pushing the teeth outside the alveolar socket, getting movement of the teeth, which is not ever the intent of the treatment.
Yeah, that's going to be really, really brilliant. I mean, it already is brilliant, but I mean, a breakthrough is what I meant to say. Because, I currently work with a couple of Vivos providers here, and I can guarantee they aren't doing all those things. And I mean, we're working together, so they're getting some of that with the co-manager there. There's always room for improvement.
Of the job is saying, I am consciously now incompetent.
Yeah.
I need to again, right?
Yes.
That's right.
So that is going to be huge in your education of that, and also just guiding them into the incorporation of that. So that's very exciting, and very thankful for your pioneering of all of those things, because it is beautiful. Like 6 months to a year is like nothing. I mean,
I think
yeah,
we're going for perfection because, a lot of those adhesions, a lot of those lesions, that the stuckness of the fascia is long term, which takes a lot to move. You've had you have them in your hands.
Sorry.
What I'm talking about. But what really is exciting to me that I want to just tell you about, this should make you really excited. The research is now leading towards CSF flow in relation to durameningeum, which is exactly what I just described. Making the cranial changes, realigning the dura, is directly responsible for movement of CSF, which is now the dead center of the focus for lymphatics. Now, why have we not looked at this before? For that last decade or so, we started looking at lymphatics, lymphatic movement in the brain, clearing the waste material from the brain, and more importantly, the deep stage, which is deep stage of sleep is important. So why did we not look at this before? Rachel, I want to go back to the beginning of this conversation.
Mm-hmm.
We actually said doctors are told what to do, right? We come out, who's going to do that research? The orthodontists who were told to believe you give your straight teeth to people and that's all there is to. Who would be doing this research?
Yeah.
A general dentist like myself with a drill in their hand and millions of dollars in debt? No.
Mm-hmm.
Unless somebody goes, I'm going to go against this and say, the herd is not safe anymore for me to be a part of. What I know is not sufficient because I have not helped anyone. And I want to end this conversation by telling you my origin story. I hope that some parent hears it out and say, hey, I need to do something now and do it fast. My daughter is my origin story. During the time 2019 is when I knew that my answers were not sufficient and wanted to come out of clinical dentistry. My daughter was at that time 6 years old. She was born in 2013 when I didn't know much at all, almost nothing about breathing and sleep and any of this. And we had a whole lot of problems with breathing, snoring, lack of sleep. She never went to deep sleep. And that terrible 2, terrible 3, they call it terrible 4. I never looked forward to this kid waking up. Like she was always groggy in the morning. And I'm thinking, when is this ever going to end? Then she go to school and I know full well, I know she doesn't sleep. I know that because she wakes up 10 times an hour. And then at school, they're telling me that she's got ADHD. And at that time, I'm thinking, there's got to be a correlation here. She's nasal all the time. When she was 3, I went to an ENT and I said, she's nasal, like almost all the time. This kid's not speaking, like she's not, the nose is not working for her and she's not sleeping. I asked for a sleep test. I was denied. Here's the spray, go home, come back when she's 8. She has a crossbite. She has a temporal, misalignment. And I could see that she's grinding her teeth. The tonsils are growing. I don't know where to go other than the ENT and the medical doctors every year, like the pediatricians. Come back when she's 8. The orthodontist told me, grind the rest of the canines on this side so she doesn't have to work any harder. That was the best advice I got. Come back when she has permanent teeth. So 2 orthodontists told me there's nothing they can do. And the second ENT and the pulmonologist, sleep physician, pediatric sleep physician, basically I demanded a sleep test when she was 6. They said, her tonsils are ripe enough. Let's go ahead and do a sleep test. Like that was the justification.
Sure.
Not the fact that she was a snoring, not the fact that she never functioned and her face wasn't growing, but the fact that she has large tonsils. We got the tonsils out with that recommendation, which did not address the ADHD, did not address the breathing issues, did not address even the way she breathed. Only maybe for a short time, it just got the snoring maybe improved for a little bit. And that was 2019. That I looked at my daughter and I'm looking at the school that are just forcing me to put her on medications for ADHD. She's in first grade at that point. And I'm thinking, if I cannot help this the most important person in my life, who else am I failing? That, like, I think that combination of everything, it was that perfect storm I needed to say enough,
Mhm.
pushing back my own mainstream. And today I'm sitting here with a skull in my hand and everything in my head, telling my child has problem all the way growing, developing, birth, after birth, like almost everything was set up. The domino was set up. When I caught it, it was not the first domino effect. It was almost like towards the end, because by the time they're 7, their face is almost done growing. And that's when I started working on my daughter. Like, I wasted all this time from the time she was 3 years old till she was 7,
Mm.
going on first. And that precious amount of time was lost because my board certified specialist I run to, they said, nothing to be concerned with, do a watchful waiting. What are we watching for? I'm going to ask the question, why didn't they ask about how she breathed and sleep? Why didn't have any interest in knowing where her nervous system is dysregulated to lead to the behavior? Why were they eager to put her on medications and pick up the scalpel when the ICD code justified it? And I'm going to say this with passion in my heart because,
Yeah.
because if I'd known when my daughter was 3 what I know now, I would have done things a lot differently. But I didn't. I didn't have access to someone like you. I didn't have access to a craniosacral therapist. I didn't know what to do. So if a parent hears, I'm praying this makes it to the ear of the right person.
Yes.
If your child is breathing through their mouth, if your child is not sleeping through the night, if they skip crawling, if they're misbehaving, that child is in survival.
Yeah.
They're in survival. Don't accept the labels. Look for someone that's holistic. At least look to the right places, because you as a parent are, I mean, you them going to internalize that and say that was my, I did that for the longest time. I should have known better. But you know what? I did the best I could, and I tried to turn that mess into my message. And today, I'm still treating Melody, doing much better, treated her breathing disorder. I made a whole post about her. And my prayer continues to be, we are here to experience the things we do to unlock our gift. So maybe my gift didn't at the time help me and my daughter,
Mhm.
but I hope and help another Melody, another mom out there with 3 kids in a rural area and say, where do I go?
Mhm. Mhm.
Run to a friendly neighborhood airway dentist, or just who only knows an expander or tongue release. At least ask these questions. Do you work holistically with someone who knows how? Ask the question, do you work with an osteopath? Do you know anything about craniopath? Do you know anything about functional health? Those questions will trigger them, at least if they don't know, to learn. But more importantly, look up the resources, doctors like yourself and I put up there. Look for those resources and ask questions. If I encourage any parent, ask questions. You're entitled. You're in charge of your health and your child's health. Ask questions. So
Yes, amen. And it's never too late. Like, obviously there's these age ranges, but I mean, I can even test you doing things as an adult because I didn't have that stuff either. And it is totally possible. Like you said, you're doing with lots of adults too. So I love
85,
that.
85.
Yeah,
Okay.
same. Yeah. So there is always hope. There is
No,
always
it's
answers. There's always grace for
not gonna pass.
wherever we miss the mark. There's always grace. So, yeah, thank you so much, Doctor. Thank you so much for your time. Thank you for this conversation. Thank you for your love for what you do and your dedication to bring this to more people. And yeah, we thank you so much. How do people find you? How do people follow you? How do people continue to connect with what you're pioneering and what you're doing?
Yeah. Well, where you and I met is probably one of the easiest and more efficient ways to find me. And if you ever wonder, my Instagram handle at the Airway Queen,
Mhm.
really original. Also, you can look me up on YouTube, The Airway Architect, and all of that is in my. If you go to my Instagram page, we have several resources up there. And if you're interested in becoming a patient, people fly from all over the world to see us. You can fill out the patient form or go to our website and drop a request. In we have a specific way of getting out of town patients in system so that their time is well spent. Also, if you want to learn more about what we do, Vivos is the company that has pioneered these appliances, and I'm so blessed. I've been working with these appliances the last 6 years. We're improving and changing.
Yes.
That's where I would go. Then we have pre-made appliances for children, which basically helps them tongue posture, utilizing musculature for chewing and growth. Super awesome. And also Vivo's website. Like I said, if you're using any of those resources, you can find us. But if you pay a visit to my Instagram, you find something you like, I'm only asking. Don't keep it a thing. Don't gatekeep it. Share it.
Yes.
This is an organic movement. I don't get paid sponsorship. I don't promote anything. I just put free information out there. And every time I finish, I'm like, God, get this to the right person and bring them to me so I can help them or someone that can help them.
Yes, yes, beautiful. Well, thank you again so much. Thank you, everyone, for listening. We hope you enjoyed this message. And like she said, please share, like, comment, send it to someone, get the word out. There's lots of hope and healing in this message today. So we love you all. God bless. And we'll catch you all on the next episode.